It's a call that's telling me I'm here to serve. It's a need to make a difference in the world. 24 hours, day or night, these healing hands will make it right. Looking in their eyes, I know that I'm changing lives. Changing lives. Changing lives for the better. For the better. Changing lives.
Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network, featuring some of the best doctors in all of the Dallas and Fort Worth area that are helping to change people's lives.
Exactly right, Candace. So let's kick off today's show with one of the best bariatric surgeons in the entire Dallas-Fort Worth area. From My Bariatric Solutions, it's Dr. Scott Stowers.
At the age of 25, about 15 years ago, I was diagnosed with high blood pressure. And with that high blood pressure came 3 medications. I had a family history of heart disease and had seen a cardiologist since I was 10. Had, just a lot of weight gain with having 2 children. My grandmother had both legs amputated with diabetes. Then my father has diabetes and, just the family history.
Yeah, Lisa is an example of one of our patients that came to see me for the typical problems of inability to lose a significant amount of weight that would affect her health.
Several different doctors for 15, 20 years had been saying that, if you could lose 70 pounds and keep it off, you would get rid of the high blood pressure. There is a huge possibility that you will not be diabetic, that even your heart condition would be just almost completely resolved, and you could even get off of all of the medications. So I chose the gastric sleeve procedure, which for me was just the best choice.
For a sleeve patient, they typically need to be at least 70 pounds overweight. Sleeve is a relatively new procedure that we do where we take out about 80% of the stomach. The whole concept of the surgery is just restrictive in nature, where they essentially are on a low-calorie diet for the rest of their life, but they're not hungry all the time.
I came in, I met with the actual surgeon. I actually sat down with Dr. Stowers, and he was amazing. Somebody who just totally makes you feel comfortable. He answered every question. He was very honest with me and reassuring. It was just beyond belief that he was able to make me feel so comfortable. At 1 week post-op, I was literally off of all of my medications. It had already made that big of a difference.
Within a year, she lost about 80 pounds.
I've reached my goal weight. It's been great going from a size 18-20 and an extra large shirt to a size 8-10 and a medium shirt. I never thought I'd see that again, so it's been really exciting.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, pulled up the neck and, so that this is really clean in here. And I had with the weight loss, I had a lot of hanging skin, and he, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. Nobody's pressuring you. So I just felt comfortable with him.
Well, Jesse came to me complaining of low back pain and leg pain. It had been plaguing him for several years and been progressively getting worse. It was to the point where it was affecting his job.
Every time I had a back spasm, I'd be out for 2 or 3 days where my back would hunch over for, I'd be stuck in this weird, awkward sideways position, hunched sideways. And every night when I went to sleep, I dreaded going to sleep because I knew I'd wake up in pain. Sure enough, it was a bulging disc on L4 and L5. Well, initially, and my doctor referred me to a spine specialist that he was familiar with and comfortable with. So I saw him for a while. I went in for cortisone injections. We went through that, went through physical therapy, and all of it helped, and it did help alleviate some of the pain, but it eventually came back. So the doctor recommended actually having some type of invasive surgery. And it was something I just really wasn't comfortable with. Luckily, at that time, Dr. Williams told me about the Laparoscopic procedure.
The Laparoscopic procedure is a minimally invasive spine surgery that addresses conditions of the spine, including herniated disc, bulging disc, degenerative disc, and/or scar tissue in a patient's spine.
The way he presented it was, here are the facts, here's what's been done on other patients, and here's the proven success rate.
Oftentimes patients come to me, and they're in so much pain and have their extremities affected so much that they can't walk without using an assistive device. That'd be a wheelchair, a cane, a walker. Upon doing the Laparoscopic procedure, a lot of these patients no longer need an assistive device.
When I woke up from the surgery, I knew that it had worked. There was this weird feeling of intense pressure gone from my back.
After Jesse had the Laparoscopic procedure, he followed up with me, and I determined that Jesse's pain was 100% gone.
I have now been able to focus more on work, focus more on and enjoying my family, getting just good quality sleep. I've been pain-free for 9 months now.
Doctors used to prescribe hormones for all menopausal women. We thought it was good for their symptoms, and we thought it also prevented heart disease. Well, we were wrong. Studies about 8 or 10 years ago showed us that it really might increase the risk of heart attack and stroke and breast cancer. However, don't be afraid of hormones for short-term and small doses, especially if you have 3 of those important menopausal symptoms. And those are moodiness, hot flashes, and vaginal dryness. If they're mild and don't bother you too much, don't worry about it. However, if they're severe, it will not hurt you to go on hormone replacement therapy for just a little bit of time. You can do it for a year or 2 at medium to low doses, and if that doesn't work, you can use higher doses. Generally, you're just trying to get over that hump of those symptoms, so there's no reason to suffer that way. Now, if you've had certain kinds of breast cancer, hormone replacement therapy is not going to be for you at all, no matter how you feel, so you'll just have to stay away from it in that case. But in general, if you have those big 3, hot flashes, vaginal dryness, or moodiness, hormone replacement may help you and those people around you.
I found out about James through a local chiropractor who has treated a lot of wounded warriors and has worked with them and donated his time to help those guys.
On February 26, 2006, we were on a presence patrol, and we got some information that they were making IEDs in a mosque, which is a place that is the majority of the time a place where we can't go mosque in schools. But anyway, we went there, we followed the information, detained some personnel, and as we were leaving there was an SV bit on site that detonated right next to my striker. A piece of shrapnel entered through my helmet over my left ear and gave me a skull fracture, a windshield skull fracture.
He was in Walter Reed for a long time, coma, trauma, and he's made a remarkable recovery. He's self-conscious about his teeth. And it's not that they were broken up or damaged in the accident that he had, but he's studying to be a nurse practitioner. And so he's seeing people in the clinic. And so then he's going in and talking to patients and people.
I have a very stern and aggressive approach, and it's just ingrained in me after 10 years of being a ranger. That's just how you communicate. I'm learning to smile. And then I realized, growing up I was embarrassed about my smile, and when I see my patients and I don't smile, it's hard for them to, this guy is too serious for me to be treating me, he's mean.
He just had a self-consciousness about his teeth, and yes, they definitely could use veneers. He has some teeth that are real crooked and tucked in and stuff, so he's a perfect candidate.
The whole team here, they've taken me in, and I'm excited about the change because I know my demeanor is going to change as I work with my patients.
I have so much respect for these guys who go and put it on the line for our country. And my dad was wounded in the South Pacific in World War II, and I'm just a big supporter of our veterans and what they do. So I wanted to help this guy. I just wanted to, and I think he's going to get a fantastic result.
For more outstanding videos and any of the great doctors you see on today's show, head to the website bestdocsnetwork.com. That's bestdocsnetwork.com. You can also request an appointment.
Sure can, and now we're going to check in with our next best doctor. It's Mohs Surgeon, Dr. Patick Walsh.
In our practice, we really emphasize patient autonomy. We feel it's very important, probably the most important thing we do. We want the patient to be involved with every step of the process in our office so they understand the nature of their skin cancer, exactly what it is we're going to do in order to remove the skin cancer, and what their options are after the skin cancer has been removed.
I have had skin problems for most of my life. When I was young, I tried to always get a suntan, but instead of getting tan, I got sunburn, and then I would just peel off.
Reverend Turner is a fine gentleman who has very fair skin and has had a lot of time outdoors, and he's developed a lot of very superficial squamous cell and basal cell carcinomas, predominantly on his scalp. Once they're diagnosed, we've removed a number of them using the Mohs technique.
It's very effective. I'm glad that I can have his expertise in treating my problem.
Anyone that develops skin cancer should be seen by a dermatologist every 6 months. And that's because we know that skin cancer is due to exposure to ultraviolet radiation. And unless you have left the rest of your skin someplace else whenever you got sufficient sun exposure to get your first skin cancer, all the rest of your skin that was there is susceptible to the same mutations that gave rise to the skin cancers.
I'm 79 years old and I'm still here. He's helped me to get as old as I am.
I've been a member of a band called Master Bones Jangle, and the Voodoo Island Cannibals were actually a pirate band. There were several times in which I've had to miss entirely the ability to go out and play with the band that I'm in and enjoy those things. Not to mention the fact that several times, band aside, I've got a 3-year-old, and more often than not, I couldn't play with him, I couldn't pick him up, I couldn't interact with him. He would crawl up into bed with me and, you know, he'd say, Daddy's sick, and he'd get his doctor kit out and try to make me feel better, but there's nothing you can do.
In this particular patient, she had multiple recurrent episodes of diverticulitis. Diverticulitis is an area where there are inflamed or infected pouches or outpouchings of the wall of the colon.
When I first came to see Dr. Macaluso, I was experiencing a lot of abdominal pain. This went on for quite some time until finally my primary care physician referred me to Dr. Macaluso.
The most common area to get diverticulitis is what's called the sigmoid colon, which is on the lower left side of the abdominal cavity and in the pelvic region above the suprapubic bone.
Unless you are having those kinds of pains, unless you are really understanding what kind of agony that is, you don't realize how good it is to simply not be in pain.
A lot of times this can be treated with medications such as antibiotics. However, if you continue to have multiple recurrent episodes of 3, 4, or 5 episodes of diverticulitis, or the attacks of diverticulitis become more frequent in time, these are the patients that we typically recommend they undergo a laparoscopic colectomy.
My recovery time was minimal at best. I was out of the hospital before the weekend was over and my surgery was on a Thursday.
The small incisions allow for quicker return to work, quicker return to normal activity.
I can actually bend down and play with my son and not worry about having to lay on my back to try to find relief from the pain. From the time in which I met him to the pre-surgery procedures, the post-surgery procedures, and then the follow-up thereafter, he's almost been like a friend. I would absolutely recommend him to anyone going through this.
I went to my youngest child's school one day for a parent-teacher meeting and was walking up and down the stairs and just exhausted. And I saw my child look back, just like, "Are you okay, Mom?" And so it was a little sad. And so I just wanted to be able to live life, be able to do things with my children and just not go through it just sad and tired and sick every day.
Lakeisha Green came to see me because she was significantly overweight and was having trouble with diabetes and high blood pressure. When I think about the people who are overweight, I think about their diabetes and I think about their high blood pressure. And I think about how that shortens their life. And I think about if there's anything that you can do to get rid of those kind of problems, that's how you're really going to help someone out.
You make up in your mind that this is something you've wanted to do for a while. You think about not being sick. You think about how you're going to feel and how you're going to look afterwards. And I just made up in my mind, and I knew it was right for me to just go ahead and do it and not fear it.
There is nothing other than this kind of surgery that will fix diabetes. What it means is you take the stomach, which is an organ about this big, and you create a small stomach by physically dividing the upper portion of the stomach away from the rest of the stomach. You divide the intestines and bring up part of the intestine to that small pouch and then reconnect it farther on down. So you've changed the pathway where food goes through, and the food no longer goes through the very first part of the intestine out from the stomach, that it changes how your body works related to diabetes. That is such a wonderful thing. It impresses me all the time.
I started noticing I'm eating less, I'm weighing less. I could see it in my face, and I could it was just an amazing feeling to just know that in a few months, in a few weeks, I was gonna be a different person, not just physically, but emotionally. and it has been great.
For doctors, MRIs play a very important role in the diagnostic process. Right now, let's hear from Dr. Mehta on why he chooses preferred imaging.
We've been using preferred imaging since 2001, since I started practicing here, and patients universally come back telling us what a great experience it was. I'm an orthopedic surgeon, board certified in orthopedic surgery and sports medicine. I do a customized knee replacement that is a special technique that is customized for the individual patient. So that knee replacement is based off of an MRI that the patient gets of their knee, their hip, and their ankle. And through that MRI, we feed that into a computer, and it creates a three-dimensional model of their whole leg. And that allows us to be much more accurate in the way that we do the surgery. So the MRI for that knee replacement technique is absolutely essential. It's a special MRI, and Preferred Imaging is specially certified and trained to do these special MRIs. Well, we love Preferred because they do a fantastic job for our patients. They get our patients in right away. They do a wonderful job at customer service and making sure the patient's comfortable through the whole experience, and really just guiding the patient from start to finish through that sometimes scary experience, and making sure that they are as comfortable as they can be. Well, MRI is a very integral part of an orthopedic practice because it's the best imaging test for musculoskeletal problems. So we use MRI quite a bit to establish a specific diagnosis, and that saves a lot of time and effort. You know, the quicker you can establish a diagnosis, the quicker you can get to the bottom of the problem and get it fixed. One of the greatest things about Preferred Imaging is that they have incredible hours, operating hours. They work from early morning till late at night and 7 days a week, and that convenience is an incredible thing for our patients because they don't have to miss work oftentimes, and they can get the MRI done right away, immediately, so that we get an answer to what's causing their problem, and we can get busy fixing it. We send patients to Preferred Imaging because we have full confidence in their ability to do a really good job for our patients, and they treat them well, and that reflects well on us.
You hear a lot about ADD in adults nowadays. A lot of people think they have it, but let me help you understand this a little bit. If you walk into a room and you can't remember why you're there, or you're having trouble getting everything done, that doesn't mean you have ADD. That means you're just kind of a normal human being. ADD is really a pretty pronounced symptom and syndrome in an adult. For example, you may be doing something at home on a scrapbook for the kids, and you hear a bus go by outside or a truck go by, and you lose your total focus and can't get back into it. That's sort of like ADD. Or you hear a phone ring down the hall at work and you lose your concentration on your computer screen. There are tests for ADD, and there's great drugs for ADD. Here's the problem. ADD drugs, they're sort of like a form of speed. They're going to make anybody feel better. They're going to make you think quicker, have more energy, get more done. But if you don't have ADD, all you're doing is taking a drug that's speeding you up, and it's really not good for your heart. So you really need to be tested to be sure you have ADD.
When you hear stages of cancer, basically stage is just a way of classifying how far the cancer has spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. That's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. Surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back in to the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
If you've had a doctor help change your life, we'd love to hear about it. Send us an email at info@bestdocsnetwork.com.
Gynecomastia is a very important part of our practice that I enjoy doing. Gyneco means woman-like, and mastia means breast or chest, so it's a woman-like breast. On a man, that means not just necessarily obesity, but also the glandular tissue that comes along with it, which is the hard, fibrous area that you can actually feel under the nipple and the areola. We see many young men who get it with the onset of puberty, and then we see many men in their 20s, 30s, and 40s who have no antecedent cause for this. Gynecomastia surgery traditionally has not been a very satisfying operation for either the surgeon or the patient. And the reason why is 99% of surgeons are still doing the same technique that's been done for the last 80 years. They put the patient to sleep, they make a 3 o'clock to 9 o'clock incision around the areola, they start cutting out the tissue under direct vision, then it starts bleeding, they can't see very well, they may get a contour problem or a depression, and then ultimately they put drainage tubes in from the side to drain out the fluid. So about 9 years ago, I came up with a new idea. No scar at all on the chest, no drainage tube. We're able to remove the two components of gynecomastia, the fatty tissue and the glandular tissue, through an incision this long under each arm. And there are two instruments that allow us to do it. It's the use of ultrasonic liposuction, and we have a multi-jointed cutting device. We're able to cut out the rest of the glandular tissue with an instrument that goes through this incision all the way down to the nipple. After we've cut all it out and it's perfectly flat, the last thing we do before closing the incisions is to re-inject the entire field with a long-acting anesthetic called Marcaine. So when the patient gets up, we've already got the compressive garment on, they're pain-free. They're typically only in the recovery in 45 minutes to an hour, and that stays numb till the next day. They wear the compressive garment under their street clothes for 3 weeks, and they're done. We see them at 8 to 10 days post-op, or we see them 6 weeks after that, 3 months after that, and they're delighted. That'll do it. That'll wrap up another edition of the Best Docs Network. Features some of the best doctors in the entire Dallas-Fort Worth area that help change people's lives. And the good news is, Candace, for more information on any of the outstanding doctors, as well as request an appointment, you can head to the website, bestdocsnetwork.com.
That's right. And if you have a question or comment for us, we'd sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.